Hi, I'm Dr. Lewis Cady, and I'm here in our TMS treatment room with one of our graduates, a lady named Rosemary. And in some of my other YouTube videos, I've shown how the chair goes up. I'm just going to raise Rosemary up so we're pretty well on same eye level. You have now gone through 30 TMS treatments here.
Yes.
At Cady Wellness. Can you review with me and our viewers what it was like when you first came here in early October?
I was severely depressed, so much so that I was not able to work in my teaching position and had applied for disability retirement. And I had seen many psychiatrists throughout that time and had been prescribed numerous amounts of medications, so much so there was like 2 armloads that I brought in to you that day.
And I think I told you, I'm convinced I can get you well in 2 to 3 months, but that's not going to be soon enough because you had to go back to work at the end of
If I
October.
were going back to work, I needed to go back in a month.
Right. So I had basically 1 month to get you better. And so we talked about the 2 fastest fastest functioning treatments, electroconvulsive therapy or shock treatments, and TMS. And with the ECT, of course, we talked about the fact that there would be memory loss. Your insurance would pay for it, but there would be memory loss and you probably would not be able to go back to teaching. And with TMS, you'd have to pay for it out of pocket, but it wouldn't scramble your brains. You'd be able to function and get back to work. And,
right.
And so you elected door number 3, the TMS.
Yes, I did.
Okay, so we were talking before we went on camera about what it was like after 2 treatments. So you came in, your first treatment was on Thursday. How are you feeling on Thursday?
The worst of the worst, the bottom of the bottom.
Okay.
Like I was able to shower and come here, and that was going to be it for the day.
With just 2 treatments, Thursday and Friday, what did you do that first weekend?
I ended up driving 2 hours to Nashville to spend the day with my son and with my daughter shopping, which was unbelievable to me that I was even able to do that.
Okay. Was there a garage sale somewhere in there in that weekend as well?
Oh yes, we had the garage sale that Saturday.
Okay, so you did you got the things ready for the garage sale on Friday night, had the garage sale on Saturday, and then went driving.
Then Sunday we went to Nashville.
Right, and then you came back on Monday with a smile on your face, as I recall.
I did.
And Marilyn, I believe, was our treater that was treating. Was
Yes.
it Marilyn? Marilyn?
Yes.
And what was that session like for you? I mean, you'd been kind of hopelessly depressed and on multiple medications, and in 2 sessions you were better. What do you remember that 3rd session being like with Marilyn?
I knew that there was hope. Finally.
Sitting here in my TMS chair where you were treated, 30 treatments, and looking back at this experience, what has it been like for you?
It's been one of the best things that has ever happened to me because I've dealt with depression for numerous years, and to finally have something that I could hold on to that got me out of that slump, because every time I got into a slump, each one was worse than the other.
Right. And that's actually the natural course of depression, in that the episodes get darker and deeper every time. They last longer and they come back more frequently, and that's the natural progression of the disease of depression if you have the type of biological indwelling chronic depression that you have had. And so I'm delighted with how well you've done.
I'm thrilled.
Now, you know, one of the things is that this is frankly a somewhat expensive procedure, and I interviewed 2 people last week, and they said, you know, we'd pay whatever to get our minds and our mood back. When you look in terms of the grand scheme of things in your life, and you're a teacher, and so you're not a rich teacher, what do you think about the value for what you paid in terms of your TMS treatment?
I can't think of anything better to spend my money on. That money, you know, that I did have.
I am really glad that you had such a great experience. Thank you so much for coming and talking with us on camera about it. I really appreciate it, Rosemary. Thank you.